A series of natural and human-made disasters in the last decade have highlighted the need for all healthcare professionals to be prepared to respond to emergency situations and mass casualty events. A disaster can have many faces: terrorist attacks, weather, pandemics, fires, or explosions.
Hospitals will be on the front line to receive and care for patients after any major disaster or event.
I string it out to 232 at 6 nautical miles. We're going up.
It's therefore vital that physicians have an understanding of the hospital incident command system and their role during a disaster, because it won't just be patient care. They will have to provide disaster-specific and related information to the hospital command system to augment an effective response.
Setting up a landing zone.
During a disaster, hospitals use a standardized process called the Hospital Incident Command System, or HICS.
It has common terminology and organizational structure. It is intended to be used for all hospitals.
Has the shooter been there by any chance or passed through recently?
One important advantage of HICS is that most outside agencies use a similar incident management system.
They have them down in radiology.
You're 84. Do you know what year this is?
In the chaos of a terrorist attack or natural calamity, shared incident command models greatly improve communication.
The Hospital Incident Command System provides a flexible reporting structure. It defines roles and responsibility, sets up communication flow and documentation.
The goal is to provide the hospital operations section with strategic direction and support by focusing additional resources, such as staff and equipment, on where it is needed most.
Yeah, I've got clarification. I was checking on the power loss at CT number 2.
The Hospital Incident Command System consists of two essential groups: the command staff and the general staff.
The incident commander is in charge of the entire operation and will determine which parts of the plan will be activated.
The command staff consists of the incident commander, public information officer, liaison officer, and safety officer. In many cases, a medical technical specialist may become key advisor to the incident commander.
12 and then a later session.
It is the primary leadership role of a physician in HICS. The Public Information Officer, or PIO, will provide important information updates to external media, staff, and patients. The Liaison Officer acts as a conduit between the hospital and outside agencies, such as public health, fire, EMS, and law enforcement, as well as other hospitals. The Safety Officer is responsible for assuring safety of the hospital responders, visitors, and patients. The Safety Officer monitors the response and anticipates any hazardous or unsafe situations. The Safety Officer can take appropriate action to eliminate unsafe conditions, operations, or hazards. In some events, the Medical Technical Specialist can assist the Incident Commander, providing physician-related advice and counsel. Physicians may be asked to fill the role of Medical Branch Director, overseeing the response of the inpatient and outpatient units.
The general staff has 4 positions: operations, planning, logistics, and finance. They are called section chiefs.
The operations section chief develops and implements strategy and tactics, carrying out the objectives established by the incident commander, including staging, medical care, infrastructure, security, hazardous materials, and business continuity.
Of this whole thing.
The planning section chief oversees all incident-related data gathering and analysis regarding incident operations and assigned resources. The planning section is responsible for developing alternatives for tactical operations and prepares the incident action plan for each operational period. The logistics section chief obtains any necessary resources asked for by operations and planning, supervising damage reporting and control, sanitation, supply, transport, and nutrition. The finance section chief monitors costs related to the incident, providing accounting, procurement, and analysis. Each role can be activated or deactivated throughout the response, depending on the need at that time.
From your point of view?
This flexibility allows HICS to be used efficiently in large and small-scale disasters, and by large or small hospital settings. Each team member is given a job action sheet outlining their job description and responsibilities. All this is contained in an incident action plan, which formally documents goals and incident strategies. Let's take a look at HICS in action and the role of the medical technical specialist. A mass casualty event has occurred, causing a surge of patients. A hospital-wide emergency is declared, and the command center is activated. The incident commander asks for a medical technical specialist to advise on issues related to hospital operations. Working through the hospital incident command system, the medical technical specialist will help maintain the routine flow of hospital patients and materials, responding to any disrupting issues. The physician gets a briefing from the incident commander. Then a job action sheet is reviewed, beginning documentation of all actions taken in the incident action plan. The medical technical specialist meets with appropriate section chiefs, determining the current status of operations, critical issues, and resources required to continue operations. If needed, staffing assistance will be drawn from the labor pool.
At the labor pool, medical staff is assigned to specific casualty care areas for immediate, delayed, and walking wounded patients.
Sir, can you walk? Do you think you can stand up? You can walk?
If more medical supplies are needed, the medical technical specialist coordinates with the logistics section chief to get them. As the incident progresses, the command staff learns that there is an influx of children. The operations section chief wants a pediatric medical technical specialist to assist with casualty care. The pediatric medical technical specialist has the same functions in caring for children's medical needs. Pediatric and neonatal patients present a unique challenge for hospitals.
Because children are so vulnerable in a disaster, a pediatric physician leader should be included as a medical technical specialist. Children have special needs, requiring a specific skill set and specialized equipment.
As the mass casualty event continues, the operations section reports that multiple trauma patients need surgery. The medical technical specialist advises the incident commander that all elective surgeries should be canceled to free up operating rooms. As the influx of casualties continues, there becomes an immediate need to open hospital beds within a short time frame. The incident commander, in coordination with the medical technical specialist, orders that the rapid discharge plan be activated.
A couple of days and had a course of strep pharyngitis that she took antibiotics for, and that was...
In a rapid discharge situation, inpatient physicians will triage their units, determining who can be downgraded to a lower level of care and who can be safely discharged. The inpatient unit coordinates with the operations section chief and the pharmacy unit leader, obtaining prescriptions and discharge instructions to go with the patient. Nursing supervisors and admissions usually will identify the number of beds that may open in the next 2 to 6 hours. The charge nurse of each unit will relay this information to the hospital command center. The medical technical specialist also collaborates with the public information officer to develop messages regarding impact on the hospital. Before these messages are released, they will be reviewed and approved by the incident commander. As the incident progresses, the medical technical specialist participates in briefings with the command staff and meets regularly with the planning section chief, updating the incident action plan.
She was kind of complaining of vertigo when she came in.
Physicians cannot afford to be passive regarding their hospital disaster response plans. As we have experienced recently, terrorist attacks and natural disasters are part of our reality. And we have a unique opportunity to lead, providing the best medical care for patients and the community through the Hospital Incident Command System. We hope you've gained a better understanding of the Incident Command System and your role. If you have further questions, please contact your Office of Emergency Management or Hospital Disaster Preparedness Coordinator. The Hospital Incident Command System. In a disaster, focusing resources where they are needed most.